Welcome to the Deep Six podcast, where we make a generational impact on you and yours. What we do here is explore a 6-point model into your health, your life, and your journey while you're here. So let's dive deep and help you thrive, not just survive. Well, welcome again. This is Dr. Lewerenz from the Deep Six podcast and also Longevity Health Institute, one of our main sponsors. And I have a wonderful, awesome guest. This is very informative today because we're going to talk about radiology and imaging, but mostly about full body MRI and MRI screening. And I think the importance of it, but also, what it actually can and how it should be used. And I do believe it is a part of the future of medicine. So I do want to welcome my guest, Ryan Ringold, from Bionicc Imaging. And welcome, Ryan. Thank you for joining us.
Well, thank you for having me. I'm excited to be here with you.
Yeah. So it's you have, by the way, a wonderful story, beautiful story, actually, because of your father, a physician. And so why don't you share that with us, because it's really why you're doing what you do.
Yeah, absolutely. So myself, I'm not a doctor. I'm not even medically trained, but I oversee Bionic body screening, the whole screening department. And the way that I ended up here was that my father, the late Dr. Ringold, he was a family practitioner for over 40 years, had a very large family practice in Dearborn, Michigan, took care of kids from the time they were 10 until they were parents. When he retired, he became a partner in this MRI facility. And so when he retired, he started coming to the MRI facility every day. And I think it was mostly so he could play online poker without my mother looking over his shoulder, because I don't know if he did much more, at the facility. But he was sitting in this chair where I am right now, became short of breath, and went to the hospital to discover that he had stage 4 non-Hodgkin's lymphoma. And he had some tumors the size of softballs growing in his chest and abdomen, and he had no idea. And that really was the impetus for starting the screening division. He went on to be treated at University of Michigan, went through very rigorous chemotherapy treatments, put it into remission, came back to work, had a lot of bad side effects, neuropathy and cognitive, and just didn't feel well. But almost a year later, it returned to his brain. So he was lucky enough to become patient number 1 in a new drug study at the NIH, which they're doing amazing things out there. And they were able to put it in remission again. Without going to the NIH, they gave him 2 months to live. He went on to become documented as the longest survivor with his form of recurring cancer, according to the NIH. He started realizing that he could have gotten in his own MRI machine probably a year earlier, 18 months earlier, and discovered cancer the size of a pea versus softballs. And that really put him on a journey. And he decided he did not want other people to have to go down the path he went down with late stage detection and all this horrible treatments and the toll it took on him and his family. And so he thought, you know what? I want to start a screening division where people will have the opportunity to be proactive, take a look inside when they're feeling healthy, and make sure there's no surprises. So we started Bionic body screening, and it really was his end-of-life mission. He was able to see it for about 1 year and help some people get screened before he passed away. And after he passed away,
And thank you for sharing that. Just for my audience, so I got to ask, because foresight, is always something that can help us, if you will, and even my audience in that. And so if you look back though at him, and this is more like hindsight, but if you look back at him, do you think he had any symptoms that you noticed that potentially could have, I do have to share this. Physicians, we often we're not the best patients. In fact, and then if, being a primary care physician, I know many of them, including myself, but you just go, go see your patients, work, deal with family, enjoy life as much as you can. And I'm sure that's what he was doing. But when you look back in hindsight, was there symptomology at all that you can think of?
So there was another symptom that he was experiencing a few months earlier that he's actually started to develop a cough,
Hmm.
and the cough at one point he was concerned with, so he went and got a swallow study done that all came back normal. And then it was several months after that when he became short of breath, and that's when they discovered it. So the first symptom was that cough, and he was a great physician. He was very smart, took care of a lot of people. So he would, he definitely wanted to follow up on things when something wasn't right.
Yeah.
But when the swallow study came back normal, he didn't think anything of it.
Yeah.
He was getting up there in age a little bit. He had some other health issues, and so just kept on
Yeah.
going, like you said,
Yeah.
enjoying life and moving forward. And then that short of breath, when it happened one day, that was
Yeah.
it. You
Yeah.
know,
And I want to take this opportunity because I actually just had this conversation in my office this week with somebody with actually his wife sitting next to him. Is some of the worst people and patients, if you will, or people in a health situation are men. And I don't, I'm kind of tongue in cheek and being funny, but I also, because we're the breadwinners usually, not always. It doesn't have to be that way. We're the hunter gatherers. We're the protectors. And, it's kind of like you feel something, you're a little tired, something's a little sore, like, oh, whatever. You tell the wife, you knock, yeah, whatever. You get something checked out and you just turn the page, especially if it's normal. And what I notice in my practice, because I treat so many entrepreneurial CEOs, presidents of companies, and everybody, every walk of life, but a lot of men are grinders. That prefrontal lobe of their brain is, it doesn't matter what they physically feel or physiologically feel, they just keep going. And I just empower everybody out there, whether they see our practice or not, that they really pursue deep dive like a full body MRI or many of the other screening things that are even simpler. But the point is don't ignore symptoms, especially if you're in your fifth, sixth, seventh decade.
Uh, Absolutely, and I think that's spot on. I mean, you have the experience with the patients, but as men just want to feel like that we can kind of do anything, and so we won't let little setbacks hold us back,
Yeah.
or little symptoms. We just kind of brush it off and think, oh, I'm going to get healthy, I'll get better, this is going to pass,
Yeah.
and then when time goes on and the symptoms may get worse, by the time symptoms are being manifested, cancer is usually stage three
Yeah.
or four,
Yep. Which
and
we make no in medicine. Truthfully, this is horrible to say, but we make no, and this is averages, but significant impact in therapy. In fact, studies show if you average everything, we've extended life at least the last several decades only. I think the study showed like 3 or 4 months when you're stage 3 and 4 cancer with our therapies,
wow.
meaning that you got to catch people when they're stage 0, 1, or 2. And this, by the way, I'm talking averages, so it doesn't mean that somebody, I've one of my best friends, known forever, had stage 3 colon cancer, and it's well behind him. I think it's 8, 10 years now, and he's doing great and thriving and all that. Has a wonderful family and life. His treatment was very successful, but I'm saying his averages. The point here is you got to catch things super early, and we're super, super big on at Longevity Health Institute and my practitioners about like, look, just because you feel good, you can't make an assumption. That old saying makes an ass out of you and me, but you can't make an
Yeah.
assumption just because, well, I feel pretty good, and I'm 40 or 50 and, that kind of thing. So this type of screening, I think, and obviously, I endorse. By the way, I asked you to be on my show.
Yeah.
You didn't say, hey, can I come on the podcast? Because that's how important I feel it is. And I've done one myself with you, a full body MRI, and I'll go over that and kind of explain what my experience was like. But I just think it's so important. So since, your Bionic imaging, tell us this full body MRI, full body screening, tell us kind of what the experience is like and, what a patient or somebody could expect.
The biggest benefit of a full body screening is it does not require a doctor's referral. So anybody could call and make an appointment for themselves. And the screening itself, what we call the full body, it's a MRI scan from the top of the head through the pelvis. So it goes to about mid thigh. So it's not looking at the arms and legs. It's not looking at your knees and your elbow joints. So if people said, oh, well, I'm hoping to get my knee evaluated, you really should get a diagnostic MRI of your knee ordered by your doctor.
Yeah.
So,
So
this is looking
can I stop you? I just want to say that because
Yeah.
you enlighten me on this too, because I'm not a radiologist, you know. And so, I order the test and I get the report. In fact, it's always funny. People bring me the disc often when I order an MRI, say on a brain or a knee or whatever it is.
Right.
And of course, I have some insight into it, but it's pretty. I rely on the radiologist. Okay.
Yes.
the reading. What we're talking about is not a diagnostic MRI. If you need a deep dive into a knee because of injury, or you're concerned about ovaries or a pelvis or bleeding or something like that, but you will get a good screen into things that are screening for. And I should have said this up front, apologize, and you can help me out here, but you're screening for mostly early tumors, cancerous and non-cancerous, also some vascular, maybe like aneurysms, and structural things, and not always malignant, but things that could structurally be a problem, which I'll mention here in a second. That something that was recently just found on their MRI, their full body MRI that actually showed of their liver. But that's the big stuff that we're looking at, and that's correct, right?
Yeah, absolutely. The big three would be cancer, tumors, risk of stroke. The screen is
Yes.
get a very good look at the carotid arteries for blockages, aneurysms, both cerebral and aortic. So those are the three biggest concerns that people would have. An unknown aneurysm that ruptures can be fatal. Stroke, debilitating or fatal. And then cancer, we all know what cancer does. And so, these are a screening. They're not a diagnostic MRI. And think of the difference is really a screening is looking at a lot of different areas of your body in a fairly short amount of time. So because it's a screening, there's going to be parts of the imaging where it takes thicker slices of imaging. Just like a loaf of bread can be cut into thin slices or thicker slices, when you get into a diagnostic MRI, the slices can be cut very, very thin. When you get into a screening, if you don't want to be sitting in the MRI machine for 12 hours, it needs to take some thicker slices in certain areas of the body in order to speed that test up. So it really is like a bird's eye view. It's like a panoramic of your insides, of your organs, from your brain through your reproductive, including your spine. And it is capable of detecting hundreds of different abnormalities. The three we talked about, arthritis, MS lesions on the brain, fatty liver, spinal disc disease, hiatal hernias, so there's a whole array of different things that can be picked up. But the biggest concern that we hear is cancer.
Right, for sure. Well, that's the biggest, obviously, the big life changer and game changer, especially detecting early. But I want to mention just a couple things because you said it just kind of came to me, is something as simple, though, non-cancerous, not really severe, but can affect people's lives every day, is a hiatal hernia. And, discovering something like that can answer questions to why somebody might have, even treated with meds or treated with, dietary changes and supplements and things like that, positional sleeping changes, whatever, because of their heartburn, their reflux, maybe their cough, their acid reflux. And that's structural, and that is one of our systems. So the Deep Six is a 6-point model approach to functional precision medicine. So we're looking at hormones, gut health, liver and how you detoxify, mind-body connection, genetics. But the sixth part of the wheel of the 6-point model, the Deep Six, is structural. And when I say that, it's not always structural. Like people, of course, you're going to think of spine or joint or pain, which is accurate. But a hiatal hernia is a structural change. We cannot, other than surgically, we cannot change a structural hiatal hernia, okay? But by appreciating that slipping of your esophagus above the diaphragm, now you can appreciate like, wow, maybe if I overeat, that's not a good idea. And maybe if I
Right. Yeah.
overeat, why do I keep getting heartburn when I lay down at night, 2 hours after dinner? Or, so I want to mention that because otherwise you got to get scoped to know if you really have a hiatal hernia, an EGD. And that's something that's really important. But structural issues can show up in our daily life. And that can be discovered on this type of test.
It can, and it's interesting. Being in your practice, do you encounter a lot of people with digestive issues or reflux? Is that a common thing that you're seeing?
It is well, remember, we're a physiologic functional practice. So yes, people come in without symptoms and they just want a longevity deep dive and be well and healthy.
Hmm.
Obviously the number one thing is in America, we see the same thing. They come in because they're tired, or they come in because of weight issues or pain. But I would definitely say the top 3 or 4 is also digestive. And we target our 6-point model with everybody because how important digestive is, because it's your immune system, it's how you absorb nutrients, it's how you literally your immune response in your body. By the way, people always think of all these other immune things. One of your biggest immune responses in your gut, and studies literally last decade, but just this last year that have been even more magnified, is your brain health, your prevention of Parkinson's, dementia, Alzheimer's, your metabolism. There's a huge component in your digestive bacteria. The microbiome in your digestive health is immensely important, as well as the digestive lining. So
Yeah.
gave you a really long answer.
Well,
But
they call it the second brain, right?
you're right. Correct. Yeah. But
Eh,
100% because we ask. We don't just, oh, you're here because you're tired. Here, take this vitamin or take this med or whatever. We ask everybody, you pooping? Sounds silly, but you pooping? You got heartburn? You bloat? Are you sensitive to foods? And by the way, pretty much everybody has some kind of answer, like whether it's a, 1 out of 10 or it's a 10 out of 10 digestive issue. Digestive issues are very common.
Well, the reason I ask that is because most people who are coming in for this are asymptomatic. They feel healthy. They want to just make sure that they don't have any surprises silently growing inside or going on inside their body. But we also get people who want to come in and they want to be proactive, but they also are trying to kind of evaluate some symptoms and maybe hopefully shed some light or get some answers or rule their worst fears out. And one thing that we hear all the time from people is digestive,
Yeah.
and
Oh,
that's always a tough one because the first question is I ask them about if they've been evaluated with their physician, have they had any scoping done, what other kind of workup have they had done, and a lot of times they're frustrated because they just don't have any answers, and maybe they're starting to now fear the worst, like
yep.
something bad's going on, and so it's important that they understand that if they come in for a screening, it may not show anything that is creating that issue. But some of the people that have come in, we had a young gentleman. He was in his 20s, and he was having trouble eating. He was feeling nauseous and had digestive issues going on for over a year. He had lost weight, and I was a little concerned that, well, you haven't found anything yet with your doctors. I don't know what's going to come up, but at least hopefully you can rule out your worst fears. If you're thinking that cancer or a big tumor is growing somewhere. Well, it turns out that his spleen was incredibly enlarged. None
Wow.
of his
Yeah.
none of that had been picked up.
Hmm.
So that was a full body screening that picked up that enlarged spleen that was explaining all these symptoms he had been having for so long.
Hmm.
Another person, hiatal hernia. We
Yeah.
pick up several hiatal hernias off of different individuals, and that gives them some feedback and
Yep.
some answers on why they're experiencing these symptoms.
Yeah.
But there's
Yeah.
other times where people will come in with symptoms and there's nothing physically there
Yeah.
that the radiologist can, but at least it rules out some worst case fears and allows them to continue forward trying to evaluate their symptoms with some new information from these screenings.
Exactly. Yeah. Yeah. I love it. Thank you for sharing. I also, I always say, because we'll talk about this, but there's a big concern about medical fear with this and, false positives. and creating anxiety, which we'll cover in a second. But I always say to my patients, information is power. I say to my kids too. That's why they should keep
I
studying,
agree.
but and learning. But information is power, and it's empowering, and it's impactful in so many things. So whether it's just ruling out stuff, but I'll give you a story, and this was literally, I think, just 2 days ago in my practice. One of my patients that lives about 6 months, maybe 9 months a year in Florida, brought me, because he did stuff down in Naples area. He brought me his full body MRI from down there, and he wasn't concerned at all. By the way, he wasn't concerned at all. He's like, "Yeah, it's pretty good." They didn't say much. They sent me the report. I had a little chit chat on the phone with the doc or the PA, and everything looked pretty good. And I go, "Great, let me just get my eyes on it." Well, he had a congestion of his liver that showed high iron. And because his liver enzymes were normal, he thought, well, this wasn't a big deal. And I think that's the advice they got, which I'm not saying that it was, big alarm that we had to rush to a gastroenterologist or oncologist or anything like that. But if we think, and this is how we think in our practice and in our precision-based kind of longevity practices, decades and years out, high iron burden in the liver is a known carcinogen to the liver. It also, if it continues to happen, the excessive iron burden in your body, which can be measured by ferritin, has been known to make you hypercoagulable, so blood thickness. And this is a huge thing, gets overlooked. I see it all the time when people come in. And if you don't get ahead of it, and yet, again, we get ahead of it because we're looking, but, people, things creep up on them. They have heart attacks from it. 10 years later, they do develop something in their liver that could be precancerous or cancerous. They get blood clots. And the interesting thing is this, because of the sluggishness of the nature of the blood, it is part of, and we all need iron. I don't want to misinterpret this, but it can make you fatigued. So we'll do a therapeutic phlebotomy, which means we just draw off some blood, which then some iron comes out. And maybe sometimes we do liver cleanses with these patients and that, and then we measure and track it, et cetera. But they feel better. It's funny, they donate blood.
Right.
We don't make them anemic. And they literally feel better. They're like, wow, is that possible? But my point is that was picked up on his MRI. And interesting, I hadn't seen him and done our blood work for about 9 months or a year, because he's been in Florida, like I mentioned, and he has a doc down there and does some stuff down there. But I didn't get it back because, like I said, this was just 2-3 days ago. But his ferritin and his iron store in his liver is going to be much higher than it was before, which can be associated to excessive drinking, weight gain, slower metabolism, aging, fatty liver, so all these things there's causes. There's also genetic causes, and those genes can be turned on that can cause a thrombocytosis, and basically a hemochromatosis, and then which are medical fancy words. Here's the thing, but your blood gets thick. Okay. But that was all picked up on that full body MRI and gave me insight to knowing what to look at. And I do believe that, not only would be successful getting ahead of it, but that kind of thing is changing and saving lives.
They give people insights into their internal health. And like you said, it's information. Information is valuable. At the very lowest rung, it establishes a baseline for someone who's healthy so that they have something to monitor against and evaluate against for, if they decide to continue getting screenings in the future. But, these when it comes to people that have symptoms and who or don't have symptoms, they're really coming in for if someone who's asymptomatic, who's just trying to be proactive, they're coming in, they just want to get a good bird's eye view. We always wish for our ultimate hope is excellent health for everybody, but let's face it, as people get older, there's always something
Yeah.
little, at least, some
Things pop up, right?
spinal, herniated disc. Well, at least that explains why I can't get out of bed in the morning,
Right.
or whatever it may be. Little things can pop up. Kidney cysts.
Yeah.
What one incidental finding on probably 85 or 90% of these screenings are little benign kidney
Correct.
cysts.
Yeah. And I got a study here that I wanted to share. I pulled this up, and there's a couple of them. There's the Pronovo internal study in 2025. There's a meta-analysis in 2025. There was a European Journal of Radiology in 2021. But basically, there is about a 20% insulinanomas, which is an incidental, basically tumor finding, or a cyst or lipoma, non-cancerous. And this varies depending on what study you look at, and these are studies that are looked at over 1,000 at least participants in full body MRI. But this shouldn't create fear, meaning because these are you see a cyst in a liver or kidney, you see a lipoma or a fatty deposit or hemangioma in the liver, or something that might be questionable. You just have to do something more of an extensive deep dive and or if it's very obvious, you take note. You know what I mean? I will tell you though that I've caught, not on a full body MRI, but getting scans for other reasons, cysts on kidneys, and the patient had underlying polycystic kidney disease, did not know it. His kidney function at that time was not bad, and we tracked it. Obviously, went to a urologist, and we had this, tracked and looked at extensively. His kidney started showing a little bit of stress in that, and then on one of his follow-ups, one of the cysts actually got big. So from a structural issue, again, one of our 6-point models, why we address structure, and we talk about structure. But the urologist did have to do a surgery on his kidney because of the structural impact on the renal pelvis. But again, this isn't cancerous. There doesn't need to be excessive worry or anxiety at some of these insulinanomas, but you might find something, and it's okay. You don't have to create fear or worry. The only thing that I would kind of educate my audience out there and people that watch this video and share it is, because like you said, Ryan, I almost called you Doc. You're pretty bright, so I'll call you Dr. Ryan. No, but
my father was a doctor, so it almost makes me a doctor.
Yeah, there you go. Yeah. Don't tell my kids that, by the way. Yeah, because they'll absorb that shit real quick. They'll be going around the house like they're running the show.
It's funny because growing up as with a father as a physician, people would always ask me medical questions. I'm thinking, I'm not the doctor. My
100%.
father's the doctor, but for some reason they thought I would have the answers.
I have some buddies that are docs.
Non-expert opinion.
Right. Well, I have some buddies that their wives get more calls. They laugh about their ER docs. Their wives get more calls than they do about medical questions. And the funny part is they're literally giving pretty good advice. Yeah. And then they'll check in.
When you're around it all the time, you know a little bit more than the next person. So
that is true. But the point here is there shouldn't be excessive anxiety or fear. What my point here is that you can get these without prescriptions. So you could just call Bionicc Imaging. You're in Southfield, correct? Michigan. Yep. And you can get these. I'm encouraging you, though, to slightly partner with a physician, or at least bring your image or bring your result, even if it's good, even if you're comfortable, but to your practitioner, to your doctor, because you may not fully understand the impact of something that's not cancerous, just so that they can get ahead of it. Okay, because some of these insulinanomas are not cancerous, but they should be trend and tracked based on size or what they could mean, metabolically in the body or chemistry in the body. So, like I mentioned about the high iron in the liver, it kind of was blown off a little bit. The patient didn't really understand and appreciate the significance of it. So that's the only thing I would share, that even though you can get these, just they're cash pay, and, make a phone call. And I encourage you to share it with your practitioner so that you can get at least some good medical guidance on that.
No question. And part of our service is that everyone gets a follow-up call from someone on the medical staff to help them understand the radiologist's report, because unless you're in medicine, that report might as well be in a foreign language. So to the layperson, when you're reading a report from a radiologist, people don't understand any of the words in there. So part of the service is that someone from the medical staff calls to go over their results with them, answer any questions. But the important thing is that they're not acting as their physician or replacing their physician. We highly recommend and encourage that everybody take their results and get them on file with their own physician. And they would need to work with their physician if they were going to evaluate anything further. So that's essential. And when it comes to the fear of things, there are false positives with full body screenings. I don't feel like that should be a reason for someone not to do it. Um, you know, we had a gentleman who was about 50 years old. His grandfather died of lymphoma. He was coming in with his wife. He was worried about lymphoma. Well, the radiologist was very concerned about enlarged lymph nodes in his chest. They came back very enlarged, and he did not like it. The gentleman, when he heard the news, didn't like it either. I mean, his grandfather had died of lymphoma. Yeah. He ended up going to his own physician. They sent him to an oncologist. Oncologist did a physical evaluation, said, I don't really like this. Let's do a PET scan. PET scan was a bit inconclusive. They did a biopsy. Long story, came back, everything was negative. So when I spoke with him, I said, well, that's a false positive. I said, are you frustrated or upset that you had to go through that as a false positive? He said, are you kidding me? He said, the reason I did this was so I could be 100% confident that I'm healthy and I don't have something wrong. He said, correct. So it wasn't an issue for me at all. And that's the response that I get from most people if there was some type of false positive. Yeah. They're doing these to be certain, and they want to follow through and evaluate anything that might pop up. Yep. But when there is a finding, Dr. Lewerenz, it really falls into one of three categories. Incidental, like these little, someone might have 2 or 3 little simple kidney cysts. It doesn't mean anything. They come, they go. 85 or 90% of the people that are walking through the door have them. There's nothing.
And I'll
that
stop
they have
you
to do.
for my audience just because of one thing that's very underappreciated and well known in a holistic, at least, or a functional medical world, is cysts in the body can be, not always because there's genetics to this, but can be associated to insufficiency or deficiency in iodine. When I see cysts in patients, I always check their iodine level. You can do it in blood and urine. In Michigan, it's very common, at least in the Midwest, to be iodine deficient. And using iodine therapeutically and tested, so done in a very precise way, because there is some side effects if you over iodinize somebody because they weren't getting enough in ionized food or salts, etc. But low iodine is associated to cyst growth in the body, particularly kidneys, ovaries, thyroid, and soft tissue.
Okay. Well, that's good to know. And that's why we always encourage everyone to, work with their physicians. But unlike you, unfortunately, there's a lot of physicians out there that still kind of practice traditional Western medicine and reactive medicine and don't do the deep dives like you do with, your patients. And so it's something that they could easily just kind of look past, right?
Correct.
But then
insist, they're not serious. I mean, like you said, it's nothing to worry about. But if you had a lot of them, or people ask, right. So why do I have all these cysts?
Yeah. And then, the other type of finding, if there was one, might be something that is not life-threatening, but it's something that when the person talks with their physician, they realize, all right, let's just keep an eye on this. At least we're aware of this now. Let's look at it again in a year, 18 months, make sure there's no changes, but there's nothing that needs to be done, today. Then the third type of finding that is much less frequent, which is good, but happens, are life-threatening or life-concerning things that need immediate attention. For example, last year we found a lung mass in a gentleman. He was asymptomatic. He came in to be proactive, and there was a lung mass, turned out to be cancer. He had to get 3/4 of his lung removed and go into treatment. But he called our facility, and I spoke with him, and he was just giving me an update on it. And he said, Ryan, I have to tell you, you guys saved my life. He said, I had no idea this was here. I had no symptoms, and I would have waited until it was too late.
Yeah.
So,
and I stop you there because you not only saved his life, but you actually saved his lifestyle. And I know that sounds weird, but I have a very similar case, and it's not the same case because this gentleman is fairly new to me, and this happened about 5 years ago in California. Very similar story. He's actually Australian. He actually, because he shared with me, and I was like, well, there you go. Even though these cancerous findings are only, in the studies, by the way, they're about 2%. And I know the vasculature abnormal findings like aneurysms are about 5%. So we're talking very low, like 2 out of 100 tests somebody does. But this gentleman I'm speaking of, non-smoker, by the way, super healthy, big biker, fitness guy and all that. I think at the time when he discovered it, he was about 48, maybe 50. He, a lesion in a full body MRI on his lower lobe of his lung. They tracked it for a bit because they weren't still 100% sure. They did a biopsy, cancer, removed it. He didn't need any chemo, any radiation. That's what I meant about lifestyle. It's not just a life-saving, but because that's way easier for the audience.
Absolutely.
A lobectomy, a lumpectomy, a pop something out and monitor than the course of stage 3s and 4s cancers, even if you live, that you have to go through chemotherapy and radiation and all that. I've lived with this in my family and loved ones. It's gut-wrenching. It's horrible even when they make it because it's such a battle and a journey and they're so strong to go through that. But so, catching something, that's the whole point. Catch it early because even if it's only the 2 out of 100 or 3 out of 100 or whatever it is, it's 100 out of 100 in your heart if it's you. And then Ryan, tell me also roughly how long it takes to get the results, and then also cost and I know you sent me, which was great. The bouquet of flowers. No, I'm joking. I had to say that. No, but I did get a very nice professional packet. Okay. You will not get flowers from Ryan. Okay, out there, his wife won't allow it. But the packet I got though was very professional. It had the disc. It had the the report. It had kind of follow up with the practitioner that if you want to get on the phone call and kind of go through it with them. So just share with my audience a little bit about that. But that I thought was, by the way, perfect because it wasn't just an email and did I lose it or did I get it? Did I forget about it? That kind of thing.
Right. So once the screening is completed, it's typically 2 weeks or less for the results to come in the mail. The medical staff actually asks for up to 3 weeks for all the results and the follow-up call, but that's usually during the holidays, at the end of the year, the beginning of the year, when there's vacations and holidays. So typically it's 2 weeks or less. A lot of times it's within a week. The results, once they get them, they get the follow-up phone call from some of the medical staff to go over it. That package will include the full report from the radiologist. It has the DVD with all their images, which has a couple thousand different images on it. And then we recommend that they share that with their doctor. There's a few different screening packages that we offer. We offer something of just the head and neck. We offer a torso, which is the chest, abdomen, and pelvis, and then what we call the full body, the top of the head through the pelvis with your spine. So the standard fee on the full body is just under $3,000. If you went to our website, you would see it listed for $2,950. They offer a spousal and family deal where if people came in for two, the price on the website is $5,200. So it's a significant investment. Right now we have what I call an ongoing $200 discount available on our website. I don't know if that's going to stay there forever or when it's going to come down, but that brings the price down to $2,750 for a full body MRI. Every once in a while throughout the year, they will run a promotion to try to help more people get this done and try to get the price down closer to $2,500 for people. So that is every couple $100 in your pocket helps, right?
Yep.
And so at those certain times of the year when they try to do a special, it gets more people, gives them more people a chance to do these. Insurance does not cover them. They do not participate. Insurance is for the way they look at it. They look at these as purely elective. It'd almost be like going to get a facelift according to insurance. Like if you're not sick, they don't want you to do it. They don't want to pay for anything. And that's what insurance is for, right? When things go wrong.
But I will tell you that's medicine 1.0. And hopefully most of you out there, if you're listening, are doing at least medicine 2.0 or 3.0, which is that doesn't make, much of a difference in your health span. You got to look and be forward thinking. And so, and this is just even different topic, but your insurance is for treatment, labs, medications, God forbid, chemotherapy, major accidents, catastrophe, hospitalizations, ERs,
Right.
et cetera. Good prevention, good primary care, even good, truthfully, where they give you time, internal medicine, things like this. Your insurance is useless.
Right. Yeah. And a
That's
lot of
my
people will
opinion.
say, "Oh,
That's my
my
opinion.
insurance." Yeah. Well, no, I agree 100%. And a lot of people say, "Oh, if insurance isn't going to cover it, why would I do it?" I think, well, that's up to
Well,
you.
well, insurance is a
But
sick model. They're there to
it's a
band-aid
sick
and treat
model,
your
right?
once you're sick. Yeah, the sick model,
And
not the wellness. And by the way, I say this in, again, this is a whole separate topic, but we live longer, we're living longer and living sicker. So think about that. Do you want to be your last decade of life, or maybe even two, where you have a lot of chronic disease and illness? Not most of us would sign up for that. And the only way you can get ahead of that is information, good deep dives, good preventative strategies, running your body like a business, really forward thinking about your health, just like you do about your family, just like your house, just like your cars, just like your pets. It's funny, but we don't think that way in our body sometimes.
well, yeah, I think it's the healthcare system that has uh, brainwashed everybody that you show up to the doctor when you're sick, rather than
Yeah.
going a couple times a year when you're feeling healthy to get your blood work done, keep your baseline, do deep dives like you do with people. And so it's a significant investment for people, and hopefully one day insurance will participate with it, or over time prices will be able to get pushed down so that it becomes more affordable for other people, for everybody.
Yeah. Well,
But
I'll
right
talk to
now it's a
Bobby
very
Kennedy about
expensive
that.
test to run. Yeah, well,
I'll
I
give
think
Bobby
that would be
Kennedy
a
a
good
call
place
about
to
that.
start.
He'd sign us
Yeah,
up.
yeah, yeah. They can you can put a little pressure on insurance companies.
Yeah.
Um,
Yeah.
but
Well,
it's a great screening tool for people that want to be proactive, and proactive, as you know, with your business. I mean, it's a growing community, and what's surprised me, one of the biggest surprises I've had since coming here, is the younger generations who are coming in here. We have
yeah.
individuals in their 20s, their 30s, their 40s. I never anticipated that. I thought everybody would be over 50 and probably into their 60s.
Yeah.
But these younger generations are much more aware, being proactive, and not wanting to be reactive the way that traditional healthcare has always been. And that's
Yeah.
been a
Yeah.
great surprise.
Yeah, actually, and I would second that because in the last, I've been practicing 3 decades. It was scary to say that, but it definitely the younger people, because I think they have foresight now, and they're enlightened by the mom, the dad, the grandparents, and that kind of didn't work out so well, maybe, or I should at least get
Right.
ahead of it because now I know what maybe my future look like. So. Obviously social media and stuff like that, it brings a lot of things to attention, a lot of a light on wellness and holistic approaches and full body approaches and things like that, which are great. So, well,
And
Ryan, hey,
a
man, I
lot of,
appreciate you. You're awesome.
yeah.
I
Hey,
appreciate, all the service you do for my patients as well as myself. And I know you're helping me already with one of my close friends get in ASAP. If anybody, they can look you up. I know you're in Southfield, Bionic Imaging. They're first class. And again, I can't thank you enough, and God bless you and your family. And I appreciate you being on.
I appreciate you having me. And I know it sounds weird, but Bionic, they spell it with two C's. So it's bionicbodyscreening.com is the full website with two C's, bionicbodyscreening.com if you want more information.
Great. Awesome. Awesome. Well, I know we'll talk soon. I appreciate it. This is Dr. Lewerenz from the Deep Six podcast. And hopefully you got a lot out of this, because this was great info on good screening, how to think differently about your health span and wellness overall. And join us again here, because, when we dissect, just like we did a lot with structure on this, this was if our 6-point model got broken down to one thing in this, this segment was the structural, not just pain, but structural organ systems, and how you can really look at these and really appreciate and get way ahead of something like a disease and even, God forbid, like cancer, so that you can be treated simply and have a wonderful health span and keep thriving. This is Dr. Lewerenz. Be well.